Infection Prevention and Control Annual Plan. So our outlines today: definition and purpose of annual plan, infection control annual plan process, goals, objectives, intervention, and evaluation. So at the beginning, what's infection control annual plan? It's a written risk-based document with goals and measurable objectives, strategies, and evaluation methods. So الannual plan هي document based على our risk assessment. So the plan addressed epidemiological important infection process and device that associated with the risk of healthcare associated infection. The scope of responsibilities for action to be taken to accomplish the goals should be included in the plan. Data, if available, should always drive the plan and should be reviewed annually. So we should review the annual plan annually, and if there is any update or if there is need for that. So the annual plan, it's responsibility, shared responsibility with infection control department and other multidisciplinary team with the hospital management. So the purpose of infection prevention and control annual plan is to outline a systemic approach to prevent and control infections in healthcare settings and to ensure the well-being of the patient. It serves as a roadmap for activities, priorities, and goals related to minimizing the risk of infection. So إذا كانت our infection control annual plan clear, so our plan for the year and our activity for the year, it will be clear for us as well. So the infection control annual plan, it's the roadmap for the whole year. زي ما قلنا الانفكشن كنترول annual plan تكون based on what? It's based on the risk assessment, which provide the foundation for effective infection prevention and control program, and serves as the basis and guide for the annual plan. So our guide, it will be the risk assessment. I think you talked the risk assessment yesterday, in the lecture yesterday. So based on your risk assessment, the plan is established and goals are set for preventing the development of healthcare associated infections within the organization and the hospital. So based on the risk assessment, we will prioritize and then we can establish our infection control annual plan. قلنا الانيوال بلان process تكون عبارة عن ايش؟ It's contain goals, objectives, strategies, and evaluation. So goals ايش هي؟ Often point to a larger purpose, simple and concise. It helps establish the overall direction. So goals larger purpose تكون عامة أكثر من objectives. Objective, it's a statement that describe program results to be achieved. So زي ما قلنا goals point to larger purpose تكون simple and concise, but objective tend to be time limited and measurable action with outcomes that help to push progress toward broader goals. Without well-written goals and objectives, it's difficult to measure your progress in the implementing your program. So the goals and objectives are prioritized in accordance with the organization vision and mission and strategic plan. So عشان كده نحتاج نركز how to write our goals and objectives علشان we can create the annual plan. later on this presentation, we will go through the goals and objectives in details. So the strategies, it's how objectives will be achieved. يعني strategies, it will be more about action. What are you gonna to do to achieve this objectives and goals? Then we will reach the last part of the annual plan, which is evaluation. You have to evaluate your progress during the year. Yani we cannot put annual plan for the infection control, then at the end of the year we will review it. No, we have to evaluate our progress either daily, monthly, or quarterly, based on the objective itself. طيب نبدأ الآن بالجولز. الجولز it's factors to consider in meeting the goals include but not limited to alignment with the hospital's strategic directions, evidence collected, available resources, urgency and severity of the situation. So surveillance is important component for gathering and analyzing the data that guide the risk assessment. يعني most likely you're gonna use your last year surveillance data, last year data to create your the year annual plan. So based on your surveillance, what's your risk or which components contain high risk, you will prioritize it during the annual plan. So goals, it can contain reducing infections risk. So the plan should address the epidemiological important infections, processes, and devices that are associated with risks of healthcare associated infections as identified by the hospital. The risk of development and the transmission of a healthcare associated infection is minimized through a hospital-wide infection prevention and control program, which identifies the risk for acquisition and transmission of epidemiologically important infection. يعني reducing infection risk, it will be based on your surveillance data. It can contain also enhancing the compliance rate to ensure adherence to local, national, and international infection prevention and control regulation and guidelines, such as CDC or WHO or MOH and GDIBC website. Like for the hand hygiene compliance rate, to maintain it above 80%. So to comply with the MOH guideline. And to addressing emerging threats, to ensure preparedness and response plans for emerging infectious diseases and or outbreak, and to incorporate the lessons learned from a previous infection prevention and control challenge. So we have to prepare preparedness and response plan in case of any emerging threats or re-emerging diseases. So, for example, for this component, like reducing infection risk, it can contain reducing the Candida aureus cases. It can contain MDRO outbreak, depend on your facility, like to achieve zero Candida aureus outbreak or to decrease C. diff cases. And in regard enhancing compliance, it can be contain hand hygiene compliance rate. As we said, for the hospital didn't reach 80%, so the goal it will be to increase hand hygiene compliance rate above 80%, to increase SSI bundle compliance rate or like ventilator associated event or a compliance rate, a bundle, ventilator bundle compliance rate. In regard of addressing emerging threats, like preparedness on emerging diseases like COVID-19 or Ebola, Zika, depend on the to be prepared about the current threats. It can contain also about staff safety, like eliminating needle stick injuries or improve healthcare immunization, like during the flu vaccine, or increase the immunity for the hepatitis B. So this is for the goals. Now we are moving to the objectives. The objectives, it should be smart. It should be written using the SMART acronym. What did we mean by SMART? SMART, it's it's mean for S, specific, for measurable, A, achievable, and R, relevant and time bounded. So we should be to be specific about what you want to achieve. Specify your objective, provide a reference point from which a change can be measured. It should be measurable and achievable. Objective should be challenging but not impossible. So you cannot put impossible objectives like to have 0 MDR all the whole year, which is in some cases impossible. And the next step for R is the objective and the scope of organizational missions. And the last part and the important part, it should be time. There should be a time limit. So for the infection control annual plan, the time limits, it's annually. So we should update it on annually basis. So this is example how to write objective. A SMART objective to maintain hand hygiene compliance rate equal or above 80% by December 2025. Why we cannot use hand hygiene compliance rate? Because the hand hygiene compliance rate, it's a sentence, it's a component of infection control surveillance, but it's not objective, it's not measurable and not timely. So we cannot use general sentence like hand hygiene compliance rate. We should be specify, increase or maintain the compliance rate above 80, and this is limited to the year of 2025. So the next example for SMART objective, to reduce central line associated bloodstream infections rate in ICUs below 0.9% for the year 2025. We cannot use central line associated bloodstream infection, as we say this is not objective. So we should be specified and timely measurable. The next example, to reduce needle stick injury in critical care area by 50% compared to last year. So it depends on our last year rate. We should decrease it or reduce it by 50%. So this objective is for the year 2025. We cannot use to reduce needle stick injury only, because this is a goal, not objective. Another example, to achieve 0 Candida aureus outbreak in the hospital by December 2025. So we cannot use reduced Candida aureus infection only, because reduced Candida aureus infection, this is a goal, not a SMART objective. So now we will move to the intervention strategies. The strategies, it's a plans or approach designed for the successful execution of objectives. So it tells us how we will achieve our objectives and what has to be done to achieve these objectives. Like we said, our objective earlier, it was to maintain hand hygiene compliance rate equal to or above 80%. Example for the intervention strategies for this objective is to monitor hand hygiene compliance on daily basis, to ensure easy access to hand hygiene product, to use visual reminders, to take immediate action or recommendation for the staff non-compliant, and to educate patients and family. Another example for the objective to reduce central line associated bloodstream infections rate in ICUs below 0.9. So our intervention strategies, it should tell us how we are going to achieve this objective for this year. So it can be by observing and documenting competency and compliance with CPC insertion and maintenance care bundles, and conduct round to audit necessity of continuation of CPC use, to give feedback to a frontline staff in real time, and to do full root cause analysis in case of central line associated bloodstream infection. This is for the intervention strategies. Now we are moving forward to evaluation, which will be the last step of the annual plan process. So the evaluation, it should tell us, have our interventions been correct? Have they been effective? Do we need to reevaluate and determine whether different interventions should be more appropriate? Do we need to reevaluate and determine whether different intervention would be more appropriate? So based on our objective and strategies, sometimes at the middle you will realize that you need more actions. There is more to do to achieve this objective. So the evaluation, it will tell you, and at the same time to do more actions, more interventions. So that's why we have to evaluate on either daily basis, monthly or quarterly, depending on your indicator. So the evaluation, it's not only at the end of the year to evaluate your progress, it should be on a regular basis during the year. So this is an example for the annual plan goals progress tracker. For the goals, we choose hand hygiene, to maintain hand hygiene compliance rate equal or above 80%. What will be our indicator? It's the hand hygiene compliance rate. So if we will check on a monthly basis, is our objectives achieved? So at the end of the year, when we will reach December 2025, we will achieve more than 80% compliance rate for the hand hygiene. But if we didn't check the whole year, if we didn't check our progress, so at the end of the year, you will realize that your hand hygiene compliance rate below your target or below your benchmark. So nothing to do at the end of the year. That's why you have to track your progress during the year. It's the same for the other, like for the central line associated bloodstream infection. We should check our CLABSI rate on a monthly basis. We should check our progress so we can maintain or achieve our goal by the end of the year. So for each objective, it should be measurable. You can measure it by your indicator, like hand hygiene compliance rate, eclampsia rate, needle stick injury rate, or the number of cases, like the number of cases of Candida aureus cases, if your objective is to achieve zero outbreak, so zero Candida aureus, zero C. diff, or zero MDRO. So your benchmark, it will be the cases. You have to check your progress month by month. So at the end of the year, you can achieve your goal. So at the end, if we will follow our goals, objective, strategies, and time frame, method of evaluation, then your annual plan, it will be like that. Your potential risk or your goal focused on hand hygiene. So the objective is to maintain hand hygiene compliance rate equal to or above 80%. And this is annually for the year 2025. How you can achieve this objective by the following strategies. So by monitoring the hand hygiene compliance on daily basis, not only by the end of the year, to ensure easy access of hand hygiene product, to use visualize reminder, to take immediate action for the non-compliant staff. So this is at the end how you can show your annual plan. It will contain your goal, your objective, your strategies or action to be done, and your method of evaluation. So in the when your objective was to maintain hand hygiene compliance rate above 80%, your method of evaluation, it will be the hand hygiene compliance rate. When our objective is to reduce central line bloodstream infection rate in ICU below 0.9, so it's measurable, our evaluation method, it will be the eclampsia rate and the eclampsia bundles compliance rate. And in case of Candida aureus, to achieve zero Candida aureus outbreak on the hospital, our action or what we can do to accomplish this objective, to screen patients coming from other hospitals and all patients admitted to ICU, apply strict transmission-based precaution, environmental disinfection with a product effective against Candida aureus, and to do full root cause analysis in case of hospital-acquired Candida aureus cases. And our method of evaluation, it will be the number of cases. Is it clear? So to conclude, infection control annual plan is essential in any healthcare organization to fully implement the infection control program and to provide safe environment for patients, healthcare workers, and visitors based on advanced knowledge, research, training, education, and human resource development. The infection control, prevention, and control risk assessment to provide the foundation for effective infection prevention and control program and serves as the basis and guide for the annual plan. Do you have any question?